It's about the graft choice in revision ACL reconstruction. And I will present a case that had a revision surgery. It's a young lady. She had a rupture of a hamstring reconstruction 3 years prior to the re-rupture, no associated injuries. And in this case, we opted for the quadriceps to revise the ACL rupture. The tunnels were not really in the wrong position, so we managed to do it in one stage, the revision surgery. What kind of graft options do we have when we consider graft revision surgery? We have autografts. These have been mentioned and by Said and by Philippe. Patella tendon is a good choice. We have more and more today hamstrings, symmetry. Once again, the stability and the re-rupture of patella tendon is less. More and more is the central quadriceps tendon done. Allograft is sometimes a good choice in revision surgery. Xenograft, I will not discuss this definitely, and synthetic graft, that has been done in the past with catastrophic results, so I will abandon this as well. The quadriceps tendon has many advantages and few complications. It's underestimated resource. We have bone attachment can be used when we use the quadriceps tendon. It's mentioned in some studies that it's twice the thicker than the BTB autograft. The cross-sectional area is larger in this quadriceps tendon use, and we also have less anterior knee pain and numbness versus BTB. However, what has been discussed, the techniques by Said and Philippe to reduce this anterior knee pain is probably very interesting. The larger cross-sectional area has been proven to be actional in patients going revision surgery, so a quad tendon is a good choice when we do revision surgery in ACL reconstruction. Now we come to the sad part of this story. 5 months after the revision ACL surgery, she slipped in the bathroom and she had a sudden hyperflexion of the knee. She had suprapatellar pain and she had an inability to raise her leg in extended position. There was a gap palpating the quadriceps tendon, and there was a complete quadriceps tendon rupture where the central quadriceps graft was taken, and we did a repair with fixation to the patella, and now she has a good function, she has a good stability, but also a good function of her quadriceps as well. Few cases have been mentioned in the literature. I found one mentioned, the latest in 2015, late quadriceps tendon rupture of the donor site after this procedure. So we should be aware about this, but still the quadriceps tendon is a good option. There is no evidence which graft should be used over the other when we use autograft. They in good hands, they give good results. The sport expectation of the patient must be considered when we make the choice of the ACL graft choice. And the failure rate in allografts that I didn't discuss here, but this has been a topic for several years, is higher in non-irradiated allograft, but there is no difference in the outcome measures. So in practice, the graft selection in revision depends on previous surgeries, has been mentioned by previous presenters as well, and it's also depending on the anatomical circumstances. In this patient, young patient, the quadriceps rupture is a rare complication of the quadriceps graft in primary ACL, or in this case, revision ACL reconstruction. So that was my short presentation of this case, and I thank you once again to listening. Thank you.